My name is Dr. Shilpi Mittal. I'm one of the stroke physicians at Jefferson Hospital. Stroke can be life-changing, but it is also something we can fight with the right response and the right habits. Today, I'm going to walk you through to how to recognize a stroke timely, how to respond appropriately, and how to manage the risk factors that can help with your recovery after you've had a stroke. Every minute matters during stroke. That's why we use the acronym Be Fast to understand what are the signs of the stroke so that we can respond timely. B is for balance difficulties. If you are having trouble walking, or you're leaning to one side of the body, or you're falling frequently. E is for eye changes, such as vision difficulty. You may lose vision in one eye or the other, or your vision may be double. F is for face weakness. You may notice drooping on one side of the face or the other. A is for arm weakness. You may notice that one of your arms or both of your arms are weak. S is for speech difficulty. You may notice that you're having trouble talking, or you know what you want to say, but you cannot get your words out. T is the time to respond and call 911 so that you can get to your nearest hospital as soon as possible. Time is critical in any brain emergency because it can be life-changing and it can prevent long-term disability and even save a life. After the emergency is over, it's a lot of times patients and families ask, what is next for us? Recovery does not stop at discharge. There is a lot we can do to reduce our risk of stroke in the next few months when that risk of stroke is highest. We want to be able to manage our risk factors, the big three. High blood pressure is one of the most important risk factors for stroke. Even small changes can increase your risk for stroke. Our goal is to reduce it to less than 130/80 unless your doctor tells you otherwise. You want to be able to eat the right diet, which includes less salty foods, and take your medications regularly. You also want to make sure that your numbers are going steadily under that goal of less than 130/80. It is one of the simplest and most powerful ways to reduce your chances of another stroke. If you have diabetes, you already know how it affects your body, but it can also affect your brain. Diabetes can lead to changes in the blood vessels that can make it more prone to rupture or clotting. We aim for good glucose control. The hemoglobin A1C less than 7% is what we target for patients who have had a stroke. In special circumstances, we may target a lower A1C of less than 6.5. You need to monitor your blood sugars regularly, take your medications correctly, and please consult your doctor regularly to make sure that the dosing is done correctly. We also recommend taking appropriate diet for diabetes that is consistently taken to reduce your chances of having a stroke. This way, you can manage not just your brain, but your whole body. High cholesterol can make your blood vessels more prone to clotting by creating the blockages in the blood vessels. You want to monitor your LDL or the bad cholesterol very closely. The goal is less than 70. Take your medications regularly. Take a diet that is low in saturated fat, high in fiber, and high in the number of vegetables. This way, you can monitor not just your brain, and you can also take care of your heart. It is not just about the labs, it's also showing up to your appointments. Ask questions to your providers. Surround yourself with support, friends, family, and trust your care teams. Stroke is hard. It is life-changing, but you are not alone. Recognize the symptoms, respond timely, and develop good habits. A good choice can be a pathway to a stronger future. It is very important to let your patients know that they can take the ownership of the recovery process. They can control what they do with their most important risk factors. And the stroke recovery does not stop in 1 month. It is a lifelong journey, and it is very important for patients to know that from their provider and understand that their providers are going to be supporting them in that long-term journey so as to make the best possible recovery from this sentinel event in their lives.